Hi, my name is Melanie Hardy and welcome to this presentation. A problem has been identified where the hospital is experiencing an increased incidence of device-related oral pressure injuries among patients in intensive care units on mechanical ventilators. These injuries cause patient discomfort and increased infections, leading to prolonged stays in the ICU and hospital and result in additional healthcare costs, as noted in Chandler et al. 2022. This led to the PICOT question that needed to be answered for this project. The original question was, for mechanically ventilated patients with an endotracheal tube, does using a commercially manufactured ETT holder reduce the incidence of oral pressure injuries compared with using cloth tape over an 8-week period? After several revisions and feedback, it evolved to this, to include more detail of how the data would be collected and monitored. For mechanically ventilated patients with an endotracheal tube in the intensive care unit in an acute care hospital in Southern California, is the incidence of oral pressures reduced, and by what percentage, using a commercially manufactured ETT holder compared with using cloth tape securement from data generated by electronic medical record documentation over 112 to 120 days collected and monitored by the Quality Improvement Department. A project is proposed to evaluate whether using a commercially manufactured endotracheal tube holder will reduce injuries compared to the cloth tape securement method. The following evidence-based practice objectives drive the project. Improving patient outcomes can reduce patient morbidity by utilizing securement methods proven to decrease the incidence of injury, noted in Chandler et al. 2022. The second objective, to enhance the quality of care, can be achieved by consistently using effective ETT securement techniques, contributing to standardized high-quality care, as noted in Holdman et al. 2020. The third objective is to reduce variations in practice. Adopting commercially manufactured ETT holders based on empirical evidence ensures uniformity and reduces inconsistent care that could lead to injury, noted in Holdman et al. 2020. Reducing variations also includes improving electronic medical record, EMR, to ensure documentation is consistent and complete. The fourth objective is to minimize costs. Preventing injuries reduces the need for treatment interventions, decreases ICU days and hospital days, and lowers the risk of infection and litigation, ultimately reducing healthcare expenditure, as noted in Moser et al. 2022. The proposed solutions for this project include replacing the cloth tape securement with one specific commercially manufactured endotracheal tube holder. This holder provides consistent tension distribution, secure positioning, and adjustability without excessive pressure to the oral mucosa, as noted in Coyer et al. 2020 and Moser et al. 2022. Another proposed solution is to improve the electronic medical record documentation. There is inconsistency in where and how to chart skin assessments and where to document a pressure-related device injury. Once this is updated, it will improve the clinician's workflow efficiency and will make data collection easier. The rationale for supporting this project is that device-related pressure injuries are preventable and a frequent complication that poses a critical patient safety concern, noted in Chandler et al. 2022. Similarly, Jenk and Yildiz in 2022 demonstrated that different securement methods have a significant impact on the development of pressure injuries, with some methods resulting in fewer injuries than others. Coyer et al. 2020 reported that structured interventions aimed at optimizing securement practices have shown promising results in injury reduction. Using a single style of commercially manufactured ETT holder ensures consistent tension distribution and a more secure positioning of the tube, thereby standardizing care. The project intervention aligns with the hospital's commitment to patient safety, high-quality care, and continuous quality improvement. Evidence-based practice is encouraged, and the Quality Improvement Department regularly monitors clinical outcomes, making the organization receptive to change backed by data. According to Ost et al. In 2020, an organizational infrastructure that supports EBP increases the likelihood of a successful implementation of practice change. This project solution also aligns with the hospital's strategic goals for reducing hospital-acquired conditions, including pressure injuries. Many stakeholders are involved in this change. However, critical care nurses and respiratory therapists are responsible for securing and monitoring the endotracheal tubes, so they must be involved early in the process. Their leaders will support the workflow integration and ensure staff compliance. Wound care, infection control, and quality improvement nurses will assist in collecting and monitoring patient data and periodically refresh staff members on appropriate skin care assessment, care, and documentation. The executive leaders must approve the adoption of the new ETT holders as the new standard of care and allocate the necessary resources. Physician support is needed to ensure interdisciplinary alignment and to reinforce the standardization of securement practices. Communication with the stakeholders will be multi-tiered. First, an initial presentation will be given to the executive leadership using data from literature and internal quality metrics. Second, there will be interdisciplinary meetings with intensive care unit staff and respiratory therapy teams to present evidence and receive feedback. Third, vendor representatives will hold educational sessions and simulations to demonstrate the ETT holder application, while the wound care nurses will hold sessions regarding proper skin and oral mucosa assessment. Fourth, ongoing quality improvement department updates regarding pressure ulcer rates in compliance with the new protocol will be provided. They will also provide tutorials on the electronic medical record updates for documentation accuracy. The expected outcomes and goals are to achieve a statistically significant reduction in oral pressure injuries and increased compliance with the use of the chosen endotracheal tube holder over cloth tape. There should also be improved documentation quality and enhanced confidence among nurses and respiratory therapists in using the ETT holder. How the outcomes will be achieved starts with collecting baseline data from a 120-day retrospective review of medical records on oral pressure ulcer incidence in patients with cloth tape securement. Then staff education and competency training will be provided to ensure proper use of the chosen single style of endotracheal tube holder. Staff will also be educated on the changes to the medical record documentation. Champions will be selected who will serve as resources and teach the other staff members. The Quality Improvement Department will monitor incident reports from real-time documentation to track compliance, and there will be weekly huddles and monthly audits to evaluate the trends and address barriers. Achieving the desired outcomes would positively affect several critical domains. Reducing pressure injuries would improve the quality of care, lower risk of infection, pain, and length of stay, which reduces organizational costs. Patient-centered care is affected when comfort and safety are prioritized, aligning with best practices. Standardizing securement practices reduces variability and simplifies documentation, impacting workflow efficiency. Environmental changes resulting from fewer ulcer incidents include lower use of wound care supplies and associated costs. Finally, staff are empowered to use evidence-based tools and interventions, enhancing their clinical skill set and upping their professional expertise. Several methods will be used as part of the implementation plan. The first step is identifying the required resources. The human resources include ICU nurses, respiratory therapists, educators, quality improvement personnel, and information technology personnel. Other materials might be needed, like training videos, printed protocols, or laminated quick reference guides. The necessary equipment includes the chosen ETT holder or any oral pressure assessment tools. Modifications to the electronic medical record are also needed for real-time monitoring. A strategic analysis and budget plan will be created to show a cost-benefit analysis that supports the project's feasibility. Each item is broken down as shown with a total projected cost of $7,000. Long-term savings are anticipated due to fewer pressure injury treatments, aligning with cost-conscious implementation recommendations noted in DOP et al. 2021. The estimated duration for the full completion of this project is 6 months, with ongoing dissemination as needed. Timely identification of issues is essential to project success. Adjustment points of 30, 60, and 90 days into implementation will guide the course corrections based on data trends, feedback, or changes in resources or patient populations, as noted in Melnick and Feinout Overholt 2023. Several triggers for adjustment will be monitored, including staff compliance. If adherence to using the new holders below 80%, targeted re-education sessions will be implemented. If there are unchanged or increased pressure injury rates, a root cause analysis will be initiated. Another trigger is resource barriers. Supply issues or staff shortages will prompt coordination with materials management or workforce planning. Documentation errors or inconsistencies will be addressed through targeted training and real-time audit feedback loops. As Coyer et al. In 2020 demonstrated, the success of interventions is closely tied to adaptive planning and stakeholder engagement. The evaluation and adjustment strategy ensures the project remains responsive to real-world conditions while maintaining fidelity to evidence-based practice principles. And thank you for your attention. Here are my references. I'm open to any questions. Thank you.